I'm Dr. SOMBAT ROJVIROJ from Bangkok Hospital, Thailand, and I'm very appreciate to be here in your city, Bangladesh, and Dhaka city, capital of the city. And I hope everybody have a very good health and have a nice day. At the Bangkok Hospital in Thailand, first of all, we select the best quality of the instruments of the joint prosthesis. Not only the primary joint, but also the revision joint prosthesis to use to the patient. So the quality of the instrument is the most concern. The second one is the technique that we use to the patient. Nowadays, we concern about the patient safety, then the good recovery. So the MIS technique, or minimally invasive, that make less soft tissue and bone damage, that make a better recovery period to the patient. And the management is also the important factors involved the recovery of patient and the result. So we set up so-called the total joint care to the patient, especially for the patient who need a joint replacement. Start from the beginning when the patient come before surgery, during the surgery, and after the surgery. So the benefit that we would like to have, first is the patient safety. Patient safety means the overall care of the patient and the patient satisfactory to the satisfaction to the result, and overall, so mainly is to the patient, and most of all is the best or the better quality of life to the patient comparing with before and after surgery. Knee replacement, yes, and total joint replacement. For example, the total knee replacement. Now we set up the so-called total knee pathway. Total knee pathway means the management of the patient who need a total knee replacement. Start from the pre-surgery evaluation, the process of the during the patient admit in the hospital, and process after discharge. So the total knee replacement, we have the JCI accreditation for the total management of the total knee replacement, for the patient safety, for the best quality after the operation. So total joint replacement, for the knee replacement, it needs 4 days in hospital. For the hip, it needs 4 to 5 days. Actually, it depends on the condition of the patient. Or, for example, if you do one knee at a time, it takes 4 days, or hip 4 to 5 days. But for the bilateral knee or two knee operation, it needs 4 to 5 days. Joint replacements not include other parts. We have set the total knee and total hip replacement every day. But overall, for the Bangladesh patient, maybe about 10%. Complication of the surgery is the same as the major surgery, but we concern first is the underlying disease of the patient that may cause complication by himself or by the patient. So we have to do the evaluation before the operation, and then we make a planning for prevention of the complication from the underlying disease. The other complication is from the surgical itself, like the infection. That's in general major operation. We have to prevent with the antibiotics. We have to prevent with a very good cleaning operating field. The other complication is the deep vein thrombosis. That is a preventable complication. The other is maybe the rehabilitation that may be caused falling or something that should happen to the patient, that we have a very good team of the rehabilitation. After surgery, actually the patient stay for 5 days in the hospital. Then we discharge to stay in the hotel. And then the first visit should be 5 to 7 days. It's about 1 week, the first visit. And then the patient can go back to the own country. Then the first follow-up, if can be the first month, the third month, 6 months, and 1 year. So about 4 times in the year. This is a very good question about the bone quality. Actually, the bone is a vital structure or a living tissue that growing along our lifetime. So it should start from the childhood and to the middle age, and especially now in the aging people. So the first factor is the nutrition, that everyone should have a very good nutrition, like a balanced diet, more vegetable, more supplements of calcium and vitamin D from nature or from the supplement, and adequate of protein, low sugar, low carbohydrate, and that is a nutrition supplement at all age groups. The second one is exercise. Exercise is very good for general health, but also very good for the bone quality, because exercise can increase the strength of the bone, can increase the density of the bone to prevent the fracture and to prevent the damage of the joint. And especially for the damage of the joint, the other lifestyle is also important. Like if you do a very vigorous or very heavy work, you have to be cautious about the loading to the back, to the hip, to the knee, that may cause a damage. So loading by your work, loading by yourself is that the body weight that you have to control, and loading by the activity that you do in the daily activities, like try not to put your knee on the floor too much, or climbing upstairs or downstairs too much. The last one is that when you have injury to your knee, to your hip or to your back, please make a good treatment and rest, and use it until after the recovery period. Don't use it too much. So general health you can do by yourself.